Tomotherapy is a revolutionary new method for the delivery of real-time, image-guided radiation therapy. As we hear from Dr. Brian Kim of Hoag Memorial Hospital Presbyterian in Newport Beach, accurate targeting minimizes damage to healthy tissues.
Tomotherapy is a new machine for radiation oncology. It's an advancement on a linear accelerator, which is the traditional machine that is used. And what's new about it is there's CT imaging available in addition to the radiation treatment portion of it. So it's kind of a marriage between a CT scan and a linear accelerator. It's a treatment tool with the capabilities of diagnostic imaging. That's what makes it so unique. And we use it for cancer patients. And really, the indications for cancer therapy is wide range. We treat the very common cancers, such as prostate cancer, in addition to the more unique cancers that we see, the rarities, special brain tumors. And we've also been able to use tomotherapy for retreatment in radiated patients who've had prior conventional radiation treatment who need more specialized therapy. The way tomotherapy works is you get essentially real-time imaging before your treatment. You can actually see where you're treating as opposed to conventional machines where patients are lined up using external markers and the radiation beam is turned on with the assumption that everything internally is lining up to what you planned. Of course, we all know that's not the case. Things can shift around internally. Tumors can move around. Your normal organs in your body can shift around on a day-to-day basis. And so what the tomotherapy machine allows you to do is to get a CAT scan every day before your treatment to know exactly where your tumor is, exactly where the normal organs that you're trying to avoid with radiation are, and it allows you to accurately target the tumor. The benefit is that you know you're not missing the tumor, but also it allows us to what I call dose sculpting, meaning we can put the dose of radiation now where we want it to go and avoid the things that we want to avoid, where typically before we weren't able to do that with the technology that we had previously. There was a lot of what we call collateral damage, meaning the normal tissues in the way of the radiation beams get the full dose of radiation. Well, with tomotherapy now, we can avoid a lot of the normal tissues and target the tumor very accurately. In addition to that, because of the CAT scan, you can see tumor response on a day-to-day or week-to-week basis. And in a lot of situations that we've seen already, tumors do respond while you're undergoing radiation treatment, and we can make adjustments, redo plans as necessary based on these images that we're not able to get with conventional machines. And fortunately, we're really one of the first centers in the country to have this implemented. And with that, we have really the greatest experience, I think, in using tomotherapy to treat a variety of cancer indications. We've also been the forefront leader in doing more specialized therapy with tomotherapy, retreatment of previously radiated patients, doing what we call stereotactic body radiation treatment, which is a newer technology now evolving in the radiation world. And we're definitely one of the leaders in California and across the country.